Hi there, this is Dr. Carmine Esposito from All Creatures Animal Hospital. Today we're going to talk about diagnostic imaging and try to give a little background of when your pets may require this. Today I have an assistant here, Mackenzie. She's going to ask me some questions that I'm going to answer for you all. And if you all have any questions beyond this brief overview of diagnostic imaging, you can always give us a call here at All Creatures Animal Hospital. Mackenzie, what's the first question you have for us?
Dr. Esposito, what type of diagnostic imaging are available for dogs?
So our dogs in today's day and age have numerous imaging options available. Today we have digital x-rays available for them. This includes whole body x-rays, thoracic x-rays, abdominal x-rays, orthopedic x-rays, even dental x-rays and cervical and skull x-rays. We also have ultrasound. There's abdominal ultrasounds, there's soft tissue ultrasounds, there are thoracic ultrasounds that look at the heart as well. There's CT imaging, there's MRI imaging, there's also scoping, there's endoscopes and laparoscopes that can be done for procedures. So there are numerous imaging modalities available for our dogs today.
In what cases will my dog need to have diagnostic imaging done?
So this is a very open-ended question. Often we pursue diagnostic imaging due to our dogs not feeling well. We may have found something on physical exam, maybe a mass in the abdomen, maybe fluid in the abdomen or in the chest. We may be having a dog that's coughing. There's some healthy conditions that we may want to monitor, something like pregnancy in a female dog. We may want to monitor. So there is all kinds of reasons to pursue diagnostic imaging.
What do veterinarians look for on diagnostic images?
Again, open-ended question here. It depends on what we are searching for. So as clinicians, we are really looking for finding a diagnosis, a reason for the presentation. So when you bring your dog in, we're trying to find you an answer and finding an efficient way of treating them most appropriately. So when we pursue diagnostic imaging, it's to find that answer for you.
What will determine which type of diagnostic imaging my veterinarian will use?
Again, that'll depend on the presentation and maybe also dependent upon what diagnostics have already been done. Often as we pursue diagnostics, we get more clues or more answers that lead us in a direction that will point us to one diagnosis or diagnostic imaging modality over another. Often x-rays and ultrasound are pursued first. And then if there is more advanced imaging required, that may be recommended later on.
How long will I have to wait for results for my dog's imaging?
Most digital x-rays, we have results pretty immediately. When we take them, we generally have answers then. Often nowadays, images are sent off to a veterinary radiologist to be read, and we get a report from them typically within 24 hours. Ultrasound, if the hospital has that ability to do advanced diagnostic ultrasounds, they may be able to give you an answer right then and there, or they may send that off to radiologists to help interpret the images that was performed during that study. CT and MRIs are more advanced. That typically is at a specialty center where they're done, and those typically do go off to radiology to be read. So those results may take a little longer to get back.
Will my dog need to be sedated for any type of diagnostic imaging?
So that typically depends on the dog's personality and how anxious they are. Digital x-rays and ultrasound, if they are very calm, generally can be done without sedation. There's always nuances to this. It depends on what we're trying to image. It depends on if the patient is painful or not, and positioning that has to be done. So light sedation may be required for some of these. More advanced imaging, CT, MRI, certainly scoping them with an endoscope generally needs sedation or full anesthesia.
Will diagnostic imaging hurt my dog at all?
No, in general, our diagnostic imaging is believed to be safe, so that they are safe modalities.
Can I stay with my dog while the imaging or scans are being done?
Often, this is not allowed. Radiographs have radiation associated with them, so owners are not allowed to be present during the obtaining the radiographs. Ultrasound itself is generally safe, and many times the owners can stay with the owners with ultrasound. CT and MRI, similar to X-rays, often the owners are not allowed to stay while those modalities are being performed.
And what happens if there are still no diagnostics for my dog after using diagnostic imaging?
So often our diagnostic imaging is one part of the puzzle of figuring out, the diagnosis for our patients, and many times we will get a diagnosis. Many times it will lead us to the next steps that are required to get a diagnosis. So often it is a key component to working our way down the path of getting the diagnosis to treat your pet. Often there will be one from our diagnostic imaging, but many times there may be clues from our imaging that tell us that we need additional testing, which will point us in a direction to move forward. As always, this is a general overview of diagnostic imaging. There are many more nuances to imaging involved, and if you have any questions, please call us at All Creatures Animal Hospital. We're always here to help and answer questions and help you get a diagnosis for your dog.